Here, I'm going to talk about the abdomen examination. An abdominal examination is a part of physical examination which a physician or a nurse used to clinically observe the abdomen of a patient for sign of disease or find out or evaluate the diseases. So now here, the abdomen examination, when a patient came to us with a problem or disease related to the abdomen, we collect the data. So subjective data and objective data. Subjective data means what patient will explain to us. Maybe they can explain or complain the change in the appetite or weight loss or weight gain. Also difficulties of swallowing, dietary intake, intolerance to certain food like irritable bowel syndrome. They are not feel good to take all kind of foods, or celiac sprue. Sometimes complain nausea or vomiting or pain. So when they eat something heavy food, spicy food, fat food, they complain the pain like gallbladder problem or bowel habit alteration, maybe diarrhea and then constipation, diarrhea, like this. Also some medication being taken, so it should be included, or history of abdominal problem or abdominal any kind of surgery. Objective data means when we measure the patient, get the vital sign, examine what data we will get it, what we feel, what we see, what we palpate, smell. So the client is asked to empty the bladder before start the abdomen examination, and be sure to warm the hands and end piece of a stethoscope, because you are going to touch your patient. So it is important to maintain the room temperature. So painful area are examined the last, right? So when abdomen or abdominal assessment is performed, the specific order assessment technique we could follow. Like first one is inspection, then auscultation, percussion, and palpation. So step by step. In this picture, we can see the abdominal cavity, what of the organ contain. This is anterior view and this is the posterior view. Anterior view, we can see the liver is occupied the right upper quadrant areas and part of the left side. The stomach quadrant occupy the left upper quadrant, and this is the spleen, and this are the colon, ascending colon, transverse colon, descending colon. In the here we can see the bladder. In posterior view, we can see the gallbladder, and this is the kidney, pancreas, and intestine and bladder. Here showing the abdomen is divided into 4 quadrants: right upper quadrant, right lower quadrant, left upper quadrant, and left lower quadrant. So you see the colon or intestine is occupied almost 4 quadrants. And here we can see 9 regions. Abdomen is divided into the 9 regions. Right hypochondriac region, right lumbar, right iliac, left hypochondriac, left lumbar, left iliac. And this is called epigastric, umbilical, and hypogastric areas. So, as I told you, abdomen divided into 4 quadrants or 9 regions. So, particular region contain the particular organ. So, if your patient said, I have a pain in the right upper quadrant, or if patient indicate the pain in the right hypochondriac region, you imagine what are the organ is located in my right hypochondriac region. Maybe problem related to that organ. So we will give the focus to evaluate the disease related to the region and organ. So like the right hypochondriac region contain the gallstone, gallbladder, stomach ulcer, or pancreatitis. So it is referred pain go that way. So this area is the stomach, epigastric. So maybe stomach ulcer, patient heartburn, pancreatitis pain, epigastric hernia. So this area is the umbilical region. Pain is more common, pancreatitis, early sign of appendicitis. Appendicitis is located right lower quadrant, but pain started around the umbilicus, and this is called referred pain. Inflammatory bowel syndrome, small bowel or umbilical hernia start here. So kidney, right kidney in the right trunk, left loin, kidney problem, diverticulitis, the left areas, right? Left lumbar region or left front. And the right iliac region, basically problem, appendicitis, constipation pain, pelvic pain, or some gynecological problem. If the pain in this area, like suprapubic area, hypochondriac region, this is called suprapubic. If the pain is here, maybe because of urinary infection, UTI, appendicitis, diverticular disease, or pelvic pain, gynecological problem. If we see the pain in the left side, left iliac region here, so maybe diverticular disease or gynecological or groin pain or inguinal hernial pain. So the first steps of abdomen examination, we go for inspection. So here, the normal findings, if you ask me, what is a normal findings of abdomen assessment? And also the normal findings, documentation of a basic normal abdominal examination should look sometime along the line of the following. Like abdomen should be soft. Abdomen should be symmetrical in all quadrant areas and non-tender without distension. And also there are no visible scar mark or lesion. And aorta is the midline without growing or visible pulsation. These are the normal findings. So here, first of all, inspect. We will check the contour, symmetry, umbilical position, and skin surface. So contour means the examiner will look down at the abdomen and then cross the abdomen from rib margin up to the pubic bones. And as I told you, abdomen described should be soft, symmetrical, non-tender, non-visible mass. Or it should be flat, rounded, concave, or protuberant. In this picture, we can see this is the abdomen is flat, this is rounded, this is scaphoid, and this is protuberant. So if the abdomen is distension, or distension can be measured through the use a tape measuring tape we can use to measure it. And then symmetry, not any kind of bulging or mass. Like patient present with a pulmonary stenosis, we can see the olive-like masses. Or any tumor, we can see the mass. And also umbilicus. So in this picture, umbilicus is the center and inverted. But in this picture, umbilicus is inverted and not in the center because of ascites. The skin surface should be smooth and even, right? So pulsation from the aorta may be noted in epigastric area, and also peristalsis wave may be noted across the abdomen. So we try to figure out the peristalsis wave is there or not. And then what next? During the inspection of the abdomen, we will check all 9 regions for scar mark, any kind of striae, abdominal striae, or any masses there or not, any distension, any pulsation, right? So after the inspection, we supposed to go for palpation. After the inspection, we're supposed to go for auscultation. The palpate is the last technique for abdomen. So examiner will perform auscultation and before percussion and palpation, which can increase the peristalsis. So you see the aorta in the midline and the right renal artery in the right upper quadrant, or we can say the right lumbar area, and right iliac arteries, left renal artery, and left iliac arteries. So hold the stethoscope slightly against the skin and listen for bowel sound in all 4 quadrants, and begin in the right lower quadrants. So if patient do not complain pain, we usually start examine from right quadrant, particularly right lower quadrant. Then we go for left lower quadrant, left upper quadrant, right upper quadrant, left lower quadrant, where we started. So we note the character and frequency of the normal bowel sound. It is usually high pitch gurgling sound occurred irregularly from 5 to 30 times a minute. Also identify as a normal or hypoactive or sometimes hyperactive. So this is the findings of auscultation. So I said, if patient have a hyperactive, means if the patient has a diarrhea, it should be hyperactive, right? So if patient has a constipation, hypoactive. Also absent the sound, auscultation for 5 minutes before determine the sound are absent. Usually bowel sound absence in case of abdominal intestinal obstruction or peritonitis. Now go for percussion. So all 4 quadrants are percussed lightly by the examiner. And border of the liver and spleen are percussed as well. And also the tympanic sound predominates over the abdomen and dull over the liver and spleen, because liver and spleen is an organ. This is the solid. You will get the dull. But the ear is present in the intestine. We can get the tympanic sound. Percussion over the kidney at the 12 ribs, we call costovertebral angles, should produce no pain. It is the normal findings. Here in the picture, first picture, we can see the percussion of the liver. Second picture, percussion in the spleen. And third one, percussion the suprapubic areas. If patient have any complaint like urinary tract infection, they will complain about the pain. The next one is a palpation. So usually there are 2 types of palpation. Basically, there are 2 types, I said, light or superficial and deep palpation, right? So here they said the examiner will begin with a light palpation in all 4 quadrants, using the finger to depress the skin about 1 centimeter, and next go for deep palpation, right? And deep palpation of the abdomen is performed by placing the flat of the hand on the abdominal wall and applying the firm and steady pressure. And it may be helpful to use the 2 hands palpation, like this picture, second picture B. Particularly in evaluating a mass. And so in this picture, we can see upper hand is used to expert pressure, while the lower hand used to the feel. I said 2 hands. This hand we used to put the pressure, and this hand, lower one, we try to feel any pathology inside the abdomen. So the examiner will palpate liver and spleen, which may not be palpable at healthy, normal individual. In case of aortic pulsation, if patient has an abdominal aneurysm, we can find aortic pulsation should be present or palpited. So aortic pulsation is palpate in the upper abdomen slightly to the left of the midline. Normally, it palpate in a forward direction. And pulsation expand laterally if the aneurysm is present. Aneurysm means abnormal weakness or abnormal wall dilatation of the aorta. In this picture showing the palpating the liver, so you see this is the put the pressure to up, and this is the pressure you put down and feel it. Palpating the spleen, and here palpating the kidneys. So before to go here, the palpating the rebound tenderness, I want to tell you, when we do the auscultation here, if during the auscultation we try to find out the bowel sound. So if the bowel sound is decreased or absent, often indicate the constipation. If the bowel sound is increased, we call hyperactive bowel sound, can sometimes be heard even without a stethoscope. Hyperactive bowel sound means there is an increase the intentional activities. And hyperactive bowel sound may happen with the diarrhea or just after eating. And now the last one here we called palpating for rebound tenderness in this picture. So what is rebound tenderness? Rebound tenderness is a sign of peritonitis. What is peritonitis? A serious condition that is an inflammation of peritoneum. And this inflammation often results from an infection. So if the peritonitis is not treated, it leads to perforation. That is the life-threatening. So you see the picture, the examiner to check for rebound tenderness. Usually a doctor or a nurse apply the pressure to the area, to an area of abdomen using their hands like this. And they quickly remove their hands and ask if you feel any pain when the skin or tissue that was pushed down move back into the place. And if you do not feel pain or discomfort, means you have rebound tenderness. And now let me go what we educate our patient after the examine of the abdomen. We encouraging the client to consume a balanced food or diet. Also, substance that can cause the gastric irritation, it is good, should avoid. Also, regular use of laxatives is discourageable. Lifestyle behavior that can cause gastric irritation, like smoking, spicy food, and should be avoided. Regular physical examination is important. Also, some laboratory test to evaluate any kind of pathology there or not. The client should also report gastrointestinal problem to the healthcare provider. This is the very basic about the abdomen examination.